Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Good morning.
You know, there's a I don't know if she's a judge or a lawyer in an organization that I'm a member of, all these women, professional women, and she listens to this show starting now.
So if
at 5 o'clock, she listens, and she always says, "You laugh too much." She always tells me that. And I said, "Listen, it's good to laugh." That's right.
Yeah.
We talk about that too, but we were laughing about.
I'm gonna let my hair down so I can come into the meeting undercover.
Right, under the cover. That's right. Put your hair
Undercover,
down.
yeah.
We're a new woman, a new guest I'm bringing in. Yeah, Andrea Mencia. Right. We'll let you go and come and drag. Okay. Yeah. But anyway, I was thinking about something and
the belly.
The belly. We
the big old belly.
The big old belly. Let's this be a belly conversation this morning. Everyone worries you don't have a belly. A lot of people do. Yeah. Talk to belly. Talk to us about bellies.
Well, I had a patient that is a faithful listener of the program. And she drove all the way from West Palm Beach, to come to the Fort Lauderdale office to see me. And, we were talking about constipation and how the large intestine is sort of a reservoir for stool. Just like the bladder is a reservoir for urine. And it's interesting because when you go and void, you pass urine, you usually will void about 25 to 75 cc of urine.
What does that mean in a cup? Tell me what I know what a cup looks like.
Yeah, so. Like 1.5 cup to 4 cups of urine you can pass. But the bladder can retain about 2 liters of urine. It can distend that much like a balloon. It will just keep going and going. And the bladder, sometimes when it's retaining, especially in men when they have problem with the prostate, and the outlet has been completely shut down. So the kidney have no idea what's going on. It just keep producing urine. Every time the heart pump, the blood will go through the kidney. The kidney will filter all the blood that is coming through, and the end result, you are producing urine. So the kidney won't stop. The kidney keep working. The bladder is just a reservoir, and you're supposed to empty your bladder. Well, the colon also is a reservoir for stool. Whether you are eating or not, the colon keep producing the mucus, and you have the bacteria in the colon that tend to ferment and produce gases. And when a person suffers from constipation, basically when we try to define constipation versus what my patient had yesterday, which is a total, let's call it a paralysis of the large intestine, where they basically are not responding to the fact that the stool is being accumulated. In a normal situation, when the stool accumulates in the large intestine, of course, it's stretched like a balloon. But then the signal go in, and that signal go to the brain and either tell you that you are full or that you are in pain, that you are so full that you are in pain, that you need to void. And the person will go either put a finger inside or put a suppository or take a laxative and empty themselves. And the main thing that will happen with this patient is that they don't empty completely. They think they have had a bowel movement. So they go like my patient will go every 4th day.
Oh, my heavens.
But not spontaneously. Every 4th day, she says, okay, I'll take a laxative and I will go now. But that's not a spontaneous bowel movement. So when I talk to physician and a nurse practitioner and nurses about the topic of constipation, in the research, we usually want to know how many complete spontaneous bowel movement a week have you had. Complete that you feel when you get off the toilet, you have emptied your intestine all the way, and that you didn't have to take anything to go. It's complete and it's spontaneous. It wasn't forced. It wasn't induced by chemical. So we were talking with the patient. I was telling the patient about taking a medication that will not be an irritant like, Dulcolax and colace, pericolace, lactulose. All of those things are irritant to the guts. They irritate the guts, and it's like when you eat spicy food. You eat spicy food. The spice, especially if you're not accustomed to it, the spice, when it hit the large intestine, it irritates. That's why if you eat spice and you have a hemorrhoid, you're going to be in pain, right? So it irritates basically the intestine. And as it irritates, it increases the peristalsis, the movement of the large intestine, and therefore you will have a good bowel movement with spices. When you eat laxative, it's the same thing, but it's not irritating the same way. But it will produce basically the same. It will increase the peristalsis and make the movement. So we were talking about, in her case, that she has a total, basically, let's call it paralysis of the large intestine. I said, with this medication, and I explained the way I have the slide for the doctors. I explained to her basically when the medication works, that it doesn't go into the liver, it doesn't have to do with the kidney, it doesn't have to do with other medication. It works just locally in the intestine. And it works basically by making the production of a chemical called cyclic GMP. And the cyclic GMP go on the other side of the wall and take the nerve ending that had been disconnected and make them start firing. That's one of the mechanisms. The other mechanism of the same drug, of the same chemical that had been produced, it goes back into the lumen and make chloride and bicarbonate go into the lumen, and therefore when you throw bicarbonate and chloride, then water will follow. And you will...
Quite a system we have.
It's a beautiful system. And it becomes, so it's not a laxative, it's a regulator. And there are a few of them. There's one by the name of Amethysa, and there's one by the name of Linces. They are both branded. They are basically relatively new, so there's no generic form of these drugs. So you can imagine they are not cheap, but usually covered by most insurance, because we just have to fight with insurance to make sure I get a cover.
But excuse me, is that like people used to take castor oil?
Exactly. Yeah. Right. But the castor oil is smooth things out, but it's not making the fluid production that we need in the lumen. So then we sit down with her, because she doesn't have a huge belly. She's in great shape.
Is that right?
She's in beautiful, great shape. And so I remember we talk about the exercises. When you're sitting in the toilet, try to sit erect. Don't bend forward. Just sit erect and put your hand on your right lower quadrant by where your appendix is or used to be. The right lower quadrant. And then you start pushing those fingers all the way up until you feel the ribs. And then you go to the opposite side at that same level until you feel the ribs on the left side. And then you go down until you feel your pelvic bone again. And then you come up to your belly button. So we did those exercises and said, next time you're going to go do it deeper and deeper. And what you're doing with your finger by massaging your big belly, the big old belly, by massaging with the finger, as you go deeper and deeper, you are basically palpating your large intestine, because that's the track. That's exactly the track from birth to end of the large intestine. It starts on where the appendix is, on the right lower side of your belly, and it comes up to the ribs, and then it turns to the other ribs on the left side, and then it goes down to the pelvic bone, and then it comes back up to the belly button, and then it goes down. Then it shoots straight down to the toilet.
So you should do this just normally? Or
normally, and I do it, when I want to empty myself, when I have a good bowel movement, I sit up straight, and in the toilet bowl, I sit and I do my massage, And you'll be amazed. Sometimes you find like a little mass of stool that is sitting either on the right side or in the middle of your belly. And if you start, even if you have it, let's say, if you have it on your, in the middle of your belly, you start from down here, you keep doing that, and you see that mass will move to the left side. So that means it have been pushed away. And once you do that, once you get to the lower part or to the more distant part of your large intestine, then it will come out. You will defecate it.
That is really an interesting system. No one's ever talked about that.
So, and Oscar, one of my nurse practitioners, and I, we are with my patient. And so I'd say, okay, let's stand up now. And we're going to do this Tai Chi exercise that is for bowel movement. And Oscar,
Tai Chi exercise for bowel movement.
Oscar is writing on the chart. He turned around. He said, he thought I was joking.
Right.
So we started bouncing. I said, before you sit in the toilet, you stand up. Come on, let's stand up.
Let's do this. This is interesting. This we're on television.
So you stand up, right? And you put your feet like the width of your shoulder.
Okay.
And then you imagine if you have the Santa Claus belly sticking out.
Yep.
Like a beer belly.
Okay.
And you let that belly hang loose and you just bounce up and down, bounce. And then you turn to one side and keep bouncing.
I'm bouncing.
And let the belly hang loose. And then you come back to the center, and then you turn to the other side.
I'm bouncing.
And keep bouncing, and then come back to the center.
Yeah.
And you do that exercise, and it's a Tai Chi exercise, and it's meant for constipation. So I taught my patient, I said, you made the big trip from West Palm Beach.
This is fantastic. I'm going to do that. I have to tell Bill while I'm doing it.
And a lot of times, let me tell you.
I get Bill to do that.
Yes. A lot of times, just with the two exercises, the finger, deep finger massage into your belly. And sometimes when you go for a massage therapy, there are some people that know how to massage your large intestine. So people will lay down and they will go and do what I was just teaching you. But you can do it by yourself. You can basically do it. The first one, the Tai Chi one, the bouncing, you want to do before you sit on the toilet. Because that will stimulate. Anything with where you're touching, you are moving the large intestine will stimulate. And my patient was telling me, well, I go for walking and I do hard steps, on the floor. Bouncing is basically the same thing as trying to walk and doing hard step, because doing the hard step can be damaging to your joints.
So that's very interesting. So we're going to bounce before we go to, and then is it after we have a bowel movement that we then do the?
Yeah, you try to see if the intestine is moving by itself. Then when you think you are done, then you do your massage. Say, let me see if I find any lumping here. And by doing the massage a few times, whatever is in there will move. And even if you don't have any lump, by just touching, you are stimulating. So if you sit on the toilet and you sit up straight, then you're going to feel that more stool is coming out. That means you are doing it right, And you don't have to be constipated. What you want to do is have a big, large bowel movement so that you move your bowel more frequently and you don't retain stool, because stool, there is no benefit of stool for health. So retaining all the stool is not going to be beneficial. Retaining urine is not going to be beneficial. It's not like I'm dehydrated, so I'm going to take the urine and reabsorb it. No, the urine is going to stay there. It's not going to come back. The stool is not going to do anything good for my body. It's done. Whatever good I was going to get from the nutrients, I got it, and the remainder is just supposed to go out. So by keeping that, remember that we have a lot of bacteria, and some of those bacteria, they ferment the stool, and then you start producing gas, and that's why you see people sometimes they burp, because they are so full in the large intestine that the gas that is being produced, gas doesn't like to go down, gas like to go straight up. So you see that the gas will come into, the person will burp, or they will fart a lot because they have produced so much gas, but the stool is not moving. What's coming out is the gas looking to escape. So
that's another very interesting subject. I'm glad you brought that up, but I'm going to tell everybody you're listening to Dr. Andy Mencia. He is a geriatric physician. It means that he is not only a medical doctor, but he has extra years of training in how to take care of the older adult. He is the founder and the medical director of AGI Medical and Dental Centers. Excuse me. His main office or center is on East Commercial Boulevard, right near Holy Cross Hospital. To call for an appointment is 954-489-1345. Again, that's 954-489-1345. And they have a Boynton Beach office over on Hagen Ranch Road. And that number is 561-270-6494. And the great part about what he does there is they have home visit services available. These are for homebound patients. Medicare and most major insurances are accepted. They're open on Saturdays. Of course, Dr. Mencia comes here Saturday morning, and he rushes to get to his office for all his patients. And if you want to get on the web, it's agifl.com, agifl.com. And we're talking about bellies, we're talking about constipation, and we're talking about farting.
Yeah, farting, And, a lot of times you always want to review your medications if constipation is something new in your life. Always go back and see what medication I have been taking. It doesn't have to be something recent. It could be something that you've been doing for a few months or for maybe even a few years. For example, sometimes when the patient is having pain or problem sleeping, they use the tricyclic antidepressant like Elavir, amitriptyline, and those medications will usually they are given to the elderly. Very erroneous. Geriatrician, we don't do that. We stay away from that. But a lot of family practitioner or internist, no training in the field of geriatric medicine, they say, well, we know that Elavir at a very low dose put people to sleep. It's sedating. So they get Elavir. But if you look at the side effect of Elavir or amitriptyline or any of those tricyclic antidepressants that you are not using for depression, but more for to help you get a good night's sleep, if you look at the side effect, it says that it's going to dry your mouth, it's going to make you retain your urine, and it will constipate you.
Great.
So
that's just impossible.
So it's called a dry sleep.
Dry sleep. So what would you recommend?
For sleep?
Take a hot bath first.
Take a hot bath, drink tea. Make love. Walk after dinner. There's a lot of things you can do. There is no medication. There's no pills. And even geriatrician, they will, in my case, I'm more prone to holistic. Let me see from the holistic, non-medication point of view, what can I do?
Eat prunes.
Eat the prunes. There's a lot of holistic things that we can do, home remedy we can do that will not harm us, that will be beneficial for us. So, but look at the medication, because medication sometimes is the culprit of constipation. So always look at the medication. Number 2, my patient, she's an excellent drinker of water. She drinks a lot of water. So we knew that wasn't the problem. Medication was her problem. And that's how we, came to see her diagnosis. But one of the things, she bought my book. And I told her, one of the medication that she's taking that was given to her by the cardiologist. Now she see a kidney doctor and a cardiologist and a gastroenterologist for her constipation. And it was interesting to see that they put her on a medication. One is a beta blocker that is good for the heart. And the other one is amitriptyline. Norvasc, amlodipine. And when they put the patient on the medication, they say take twice a day, And her blood pressure, she said, my blood pressure is too low. I said, well, if you have kidney problem, this is not really the right medication for you to be on. She should be on a medication that will protect the kidney. And the one that she's taking, both of them are good for the heart, but none of them are good for the kidney. So I told her, down the road, once we fix your constipation, then we'll talk about changing your medication around so that we can give you something that is more adequate for the whole you.
Before we continue with the fat belly and all the other things we're talking about, I wanted to ask you something. You're very good at medications. How do you know so many medications out there? How do you know about
I lecture.
medications?
I spend a good time of my life lecturing to other doctors because it is hard. There's not enough geriatricians. First of all, we have to face reality. We cannot be selfish. There are not enough geriatricians to go around for the population. The people in their 80s is the faster growing segment of our population. It's not the kids, it's not the teenagers, it's people moving from their 70s to their 80s. It's a fast growing. So, I spend a lot of time educating other doctors on topics of geriatric medicine. And I speak for most pharmaceutical companies, trying to educate other doctors so that they are in tune with with geriatric care. So by teaching, you learn. So I'm always learning. And everything that comes out, if I'm not comfortable with that, as I do my research, I will never use it on my patient. But if I do my research and I look at the whole mechanism, how this works, what is the side effect profile, I say, this is something that if I have that condition, I would love to take this kind of drug. Like, for example, now we talk about the cholesterol and how hard it is to take those pills because of the side effect, the muscle ache and all the things that we get with cholesterol medication. There's an injectable now that when I lecture to other doctors, I ask, have you prescribed it? No, not yet. I'm still waiting. But they say every time I get sample, I use it. So they use it on themselves to lower their cholesterol. And it's an injectable that is only twice a month, which is great. You inject yourself twice a month with a tiny needle, and you can maintain your cholesterol well controlled. There's a lot of new thing going on with constipation. There's a study going on. There's a company in Israel that is coming up with it's like a little vibrator. You swallow this little pill, and it's a vibrator, and it will go down the intestine, vibrating, and make you have a bowel movement.
Wait a minute. No, I thought I wasn't hearing right. It's a pill that's really a vibrator?
It's a vibrator, right? But I don't think that's going to be pan out. I don't think that's going to go anywhere because you can do even better by just doing it with your finger, stimulating by yourself with your finger. The only time that the finger will not work if you have a huge chunk of fat in front of your belly that you cannot penetrate. So you will have to lie down and have a massage therapist really try to get in there and go deep inside. But there's a lot of research, and I'm always in touch with what's going on in the world of research. Research is we see problem day in and day out, and we think like, how can I solve this problem? How can I do better for my doctor? And there are people that they dedicate their life to research. I love the clinical aspect. I'm a clinician. I love being a diagnostician. So I do research, but I cannot stop practicing medicine. I love continue to practice medicine and teach at the same time. But some people do just one thing.
Right, but the way that you practice medicine is so admirable, the fact that you look at the medication, but you're smart enough to know what the medication does and what it doesn't do. And so you always try to do this holistically first. But then I'm always concerned, just as you said, doctors don't know what the medications really are doing. Many of them depend on the pharmaceutical rep comes in, tells them, but they don't have enough knowledge to be able to put it all together. So that makes you quite unique.
And I try. I by being a clinician, I can save a lot of money sometimes to my patient, because I tell you a story. I have a patient that he's 52, and his wife is 30, 32 or 31 years old, and he's concerned about having babies. So he said, "Can you recommend me to go to somebody to see if I'm capable of having kids?" And I said, well, before, it's going to be expensive to send you to somebody, It's you're going to spend a few, I mean, he has the money. He has plenty of money. But still, I say, let's do the simple thing first. Go and give me a sperm sample. We're going to send it to the lab, and we analyze the sperm. So we got a sperm sample. We send it in. The sperm came back. The motility is great. The shape is great. They are in good shape. I said, listen, if we go into the Olympics, your sperms are ready to win gold medal. So don't waste your money going to a specialist for anything. Just, learn how to time yourself with your new wife so that you are able to get her pregnant. So I told him about, after the menstruation, 10 to 12 days after that's when the woman is going to be ovulating. You want to be around, make sure you make love with her, blah, 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 check the fluid in the vagina, simple thing. And we save a lot of money,
Dr. Mencia, it's always such a pleasure to have you here. And even though we talked about fat bellies and constipation, we'd always learn a great deal. And now I know how to massage my stomach. Unfortunately for me, I don't know why, but I'm never constipated. I'm so regular every day, and that makes a
me too,
big
yeah.
I mean, I don't know why, but it's wonderful to have that. But for people who don't have it, I know it's very troubling, and I'm so glad that you're there.
And talk to your doctor about it.
Right.
Don't keep it to yourself.
Right.
There are solutions out there.
Yeah.
And
Well, thank you very much. And I know you're rushing off to your patients this morning. If anyone wants to go in on a Saturday appointment, go see how see how gorgeous he looks, and then he'll give you a hug, and then he'll help you feel much better. Thank you so much for being here.
Have a good one, Anita.
All right.
Bye-bye.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.